Good afternoon. Thank you so much for this opportunity. I'm Ratih Wirapuspita Wisnuwardani from Samarinda, East Kalimantan, Indonesia. My research is about cadre performance or community health worker performance and posyandu activity during the pandemic of COVID-19. This study is a cross-sectional study in several East Kalimantan cities. Malnutrition is still a major public health problem among children under 5 years old, including in Indonesia. The prevalence of stunting in Indonesia was 29.9%, while the prevalence of overweight and obesity were 8%. Growth monitoring program is one of programs to prevent malnutrition. Indonesian government extends the access to the healthcare through Posyandu to prevent the malnutrition by growth monitoring program every month for children under 5 years. However, the participation of mothers to Posyandu is still low. Improving the quality of Posyandu service and providing qualified resources, including CADRES, are needed to improve the participation of mothers. During the COVID-19 pandemic, Indonesian government takes an action to reduce, control, and mitigate the spread of COVID-19, such as promoting physical distancing, wearing a mask, keeping rooms well ventilated, avoiding crowds, washing hands, and vaccination. The government of Indonesia is also enforcing the large-scale social and community activity restriction, or pembatasan sosial berskala besar, and now is pemberlakuan pembatasan kegiatan masyarakat that affects Posyandu activities. However, some Posyandu are still open during the COVID-19 pandemic. Posyandu activity might depend on the cadre performance. Over the last 10 years, there has been great interest to improve the cadre performance through cadres incentives, such as training, transportation cost refund, training transportation cost, salary or cost incentive reward, encouragement by local leader, and infrastructure in Posyandu. However, such studies during the pandemic of COVID-19 have not been undertaken in Indonesia. Therefore, this study aimed to evaluate the association of incentive, cadre performance, and Posyandu activity during the pandemic of COVID-19. This study was conducted from February to May 2021 and was from 8 cities around East Kalimantan. Using face-to-face interview and online questionnaire among 116 active cadres. We use demographic and lifestyle measurements like sex, age, city, occupation, and education, hand-washing facilities, and thermal gun. The incentives of cadres was reported as transportation costs, operational fund assistance, community cost incentive, health benefits, certificate, training, and training transportation costs. Posyandu activities were defined as closed or open operational service of Posyandu every month during the pandemic of COVID-19. The performance of cadres was based on information about the activity of cadre before, during, and after the opening day of Posyandu. For statistics, We use chi-square and multi-level logistic regression with Model 1 adjusted for sex, cities, education, and occupation of cadres. Model 2 was additionally adjusted for cadres incentive and washing hand facilities. Confounder was based on significant association with either Posyandu activities or cadres performance. And the results. More than half of Posyandu in East Kalimantan were open every month, around 56% during the pandemic of COVID-19. And the majority of cadres had very good performance. Opening Posyandu activities were higher in cadres with 36 until 45 years, housewife, higher education, very good performance, got incentive like transportation cost refund, training transportation costs, and availability of hand washing facility. Very good cadres performance were higher in Kutai Kertanegara, closed Posyandu activities, had received transportation costs and training transportation cost incentive, and availability of prevention COVID-19 facilities like hand washing facilities and thermoscan. Cadres performance had significant association with Posyandu activities, but only in Model 1. A higher cadre performance was reflected open Posyandu activity. Incentive cadres was significantly associated with Posyandu activities, independent from hand washing facilities and incentive. So the conclusion, incentives might help improve the cadre performance during the pandemic of COVID-19, as they were consistently related to the cadre performance and Posyandu activities. Nevertheless, hand washing facility is related with cadre performance and Posyandu activities. These findings suggest the importance of hand washing facilities in Posyandu and incentive, money and non-money, for cadres during the pandemic of COVID-19. Future studies using longitudinal data and intervention study are needed to determine which incentive that can affect more to the performance of cadre Posyandu. Thank you so much.